Hello my dear students, I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for last 25 years and I love it. Today we're going to talk about the facial nerve supply and related applied anatomy. Okay, so let's solve an MCQ to understand what is the necessity of this class. Okay, so a lesion causing compression of facial nerve at the stylomastoid will cause the following: facial paralysis and loss of taste, facial paralysis and loss of lacrimation, facial paralysis and dry mouth. So we agree that it causes facial paralysis. But which of the options is correct? Does it also cause loss of taste? So many questions in our mind for which we need to understand our facial nerve well. Again, very commonly asked question, what is Bell's palsy? Write a note on Bell's palsy. You got to know your facial nerve well. So let's dive into this. We're going to learn about nerve supply of face, which is motor and sensory, as well as related applied anatomy. A request to all my viewers, please keep a packet of color pencils and drawing sheets or maybe some instruments of digital drawing ready with you. When I ask you to draw, my humble request to you is please draw. By drawing, you are opening out a new area in your brain for the process of learning. It will much improve your recall. Believe me, it's been researched and it's found that when you draw along, okay, it helps you to learn faster and gives you a better recall. So hopefully you will follow my instructions. And let's begin nerve supply of face. The face, my dear students, is supplied by 13 nerves. Oh my God. It's not that difficult. In fact, it's quite easy. One of which is motor, which is the facial nerve. And the other 12 are sensory, out of which 11 are branches of trigeminal. So 11 branches of trigeminal. And there is only one great auricular nerve. So essentially, that's the crux of today's class. Okay. I want to begin by talking about the facial nerve. Right. So motor supply of face is by the facial nerve. Let's talk a minute about development. The whole muscle of facial expression or muscles of the face are developed from the mesoderm of second branchial arch. What is the nerve of second branchial arch? It's the facial nerve, which supplies all these muscles. So, all muscles of facial expression are supplied by facial nerve. So if you want to understand facial nerve, what do you also have to understand? Muscles of facial expression. I've done a lecture on this. It's out there. The link to it is given in your section. But I'm going to revise it quickly with all of you because unless you know muscles of facial expression, I cannot teach you facial nerve. So let's see. Have faith. We will learn muscles of facial expression and then we will study the facial nerve. Right. So you can see a diagram with a lot of expressions or a lot of muscles there. Let's group these muscles, okay? One's around the orbit and forehead, one's around the nose and one's around the mouth, okay? Around the orbit and face, there is one occipitofrontalis. Just keep repeating. As I am teaching you, it would be nice if you kept repeating. Okay, occipitofrontalis, procerus, corrugator supercilii and orbicularis oculi. Okay. What are their actions? Occipitofrontalis will cause horizontal creases to appear on your forehead as in surprise. Procerus, corrugator supercilii, frowning. Orbicularis oculi tightly closes the eyes. Okay. Let's go to the nose now. The nose shows two muscles here, nasalis. One is a compressor nares, the other is a dilator nares, as in anger. So two apertures over around the eye, around the nose. Now let's come to muscles around the mouth. Remember, these will be grouped as muscles that pull up your upper lip, elevators, levator. Pull up the angle of the mouth, levator anguli. Pull down the angle of the mouth, depressor anguli. Okay. So use the name of the muscle to remember the muscle itself. Levator labii superioris alignasi because it's giving a fiber to the nose. Levator labii superioris. Zygomaticus major and minor, muscles coming from zygomatic arch to the mouth. Risorius. Depressor anguli oris, which will pull the angle of the mouth down. Levator anguli oris, pull the angle of the mouth up. Orbicularis oris, muscle around your mouth. Depressor labii inferioris and mentalis. Now this is a lot of muscles for you to remember at this stage, but we'll do it again till you do remember. Right. So this is now a section seen, a view from the side, okay, because I need you to know a few more muscles. This is occipitalis. These three muscles that you're seeing are all muscles of the ear. They're all vestigial, but they're there. Okay. So this is auricularis superior, anterior and posterior. There are two muscles here below which also are required because they're supplied by facial nerve, that is stylohyoid and posterior belly of digastric. Now you see a lot of muscles in the front. We've done them once, but I'm going to make you do them again. Please pay attention and see if you recall these muscles. A muscle over here, a part of scalp, frontalis, causing you to frown, procerus and corrugator supercilii. Around your eye, orbicularis oculi. At your nose, nasalis. Now, towards your upper lip, levator labii superioris and alignasi. Depressing the lip downwards. If there is somebody elevating it up, there has to be somebody pulling your lip down to open the mouth wide. So, depressor labii inferioris. Levator labii superioris. Depressor labii inferioris. Opposite acting muscles. Right. Levator anguli oris, lifting the angle up. Depressor anguli oris, lifting the angle down. Mentalis, present here. Zygomatic, from zygomatic bone, zygomaticus major, zygomaticus minor. Risorius, causing you to smile. Buccinator, orbicularis oris, both muscle of the cheek and muscles of the lip. Finally, platysma here. These are muscles you need to remember to be able to really understand your facial nerve well. Right. So, facial nerve is a nerve that supplies all these muscles. Why? Because they develop from second arch and facial nerve is the nerve of second arch. So, let's now begin a story, students. I'm going to tell you the story of the facial nerve. Okay? It's nice, isn't it, to once in a while listen to a story instead of just keep studying anatomy. Right. So, let's begin the story of the facial nerve. Of course, I'm going to give it to you in short. Long time ago, in the brain, in your brain stem, in pons, started a nerve called the facial nerve. Okay. It came out of the pons, okay, into, give me a minute. It came out of the brain into the cranial cavity. It wanted to supply muscles of facial expression. That means it had to now exit from the skull. It began to look for a foramen. How do I exit? How do I leave the skull and come out to supply the muscles of facial expression? Right? So that was what happened to the facial nerve. While it was looking for some exit, it found this tiny foramen, which is the internal acoustic meatus. Can you repeat it, please? Internal acoustic meatus. Through the internal acoustic meatus, it entered into the petrous part of temporal bone. That is the middle ear. And then what it did was it gave a lot of branches in the middle ear. Still it was looking for an exit. Finally it found stylomastoid foramen through which it came out, and then it was out there, okay, to supply all the muscles. So this course of this nerve inside the cranial cavity is called as intracranial course of facial nerve. What is it called? Intracranial course of facial nerve. So the story continues. Now we're going to rename it. It's the extracranial course of facial nerve. Okay. So what happened now after it came out was it began to travel forwards, superficial to the styloid process to enter into your parotid gland. Now you're thinking, ma'am, the story is getting too long. We are not able to relate to it at all. Fine. Let's look at an image and understand, because that's the way anatomy is learned. Come on, let's look at an image. Can you see this image? Can you see this image here? So what you're seeing is your the facial nerve is emerging out of the stylomastoid foramen. It's giving rise to the first branch, the posterior auricular nerve. This goes on to supply the occipital belly of occipitofrontalis, auricularis posterior, stylohyoid, and posterior belly of digastric. Okay, that's why I had introduced these muscles to you. Now it goes forwards and divides into two branches, a temporofacial and a cervicofacial. The temporofacial then divides into two branches. Temporal, please follow the arrows and the colors, it will help you to remember. Temporal and the zygomatic branch. These are branches of temporofacial. Cervicofacial divides into three branches. Okay, buccal branch, marginal mandibular branch, and cervical branch. Yes, things are getting a little difficult. Let's go forward and see how we'll understand this. So this is basically the nerve that we've been seeing. I've removed the face and what is left is the nerve itself. Looks quite complicated, right? This particular pattern of branching of the facial nerve is called as pes anserinus, or foot of a duck appearance. Okay? To understand this best, I suggest that we draw it. Okay? So all of you take your color pencils, iPads, whatever else you want, and let's now begin a diagram. So I want you to first draw the stylomastoid foramen. Remember, the stylomastoid foramen is the foramen through which your facial nerve has exited, right? So let's draw the stylomastoid foramen here. Draw your facial nerve exiting out from it. The facial nerve, once it comes out, gives rise to posterior auricular branch that supplies your occipital belly and auricularis posterior. It also gives branch to the posterior belly of digastric and to the stylohyoid. After this, your facial nerve enters into the parotid gland and divides into a temporofacial and a cervicofacial. The temporofacial, as you can see, is dividing into two branches, a temporal branch and a zygomatic branch. The temporal branch now supplies the leftover auricular muscles, superior and anterior, and then goes forward to supply the frontalis, corrugator supercilii, procerus, and the orbicularis oculi. The leftover zygomatic nerve also supplies the orbicularis oculi. So muscles around the orbit complete. The cervicofacial now divides into three branches, the buccal branch, marginal mandibular branch, and the cervical branch. The buccal branch goes on to supply all muscles above the upper lip. So that means nasalis, levator palpebrae superioris alic nasi, levator labii superioris, zygomaticus minor, zygomaticus major, and levator anguli oris. The lower branch of the buccal nerve goes on to supply only two muscles. One is the buccinator and other is the orbicularis oris. Thus, the buccal branch divides into an upper buccal and a lower buccal. Upper buccal supplies all muscles above the lip and the lower buccal supplies the muscle of cheek and muscle of lip. We now come to marginal mandibular, which supplies muscles along the mandible. So, mentalis, depressor labii inferioris, depressor anguli oris, and the risorius are all supplied by your marginal mandibular nerve. Finally, the cervical branch goes down into the neck to supply your favorite muscle, the platysma. So, let's now, just to add a perspective, add the parotid gland to this. Okay, so here's your parotid gland. Okay, and you can see now, color it up nicely, enjoy yourself, students. Never force yourself to do something you don't enjoy. Studying can be fun, believe me. So your parotid gland now, as you can see, that the facial nerve enters parotid gland and then divides into the final 5 branches which are emerging from its anterior border. The 5 branches from above downwards are temporal, zygomatic, buccal, marginal, mandibular and cervical. Okay, so these are branches of facial which come into the face to supply muscles of the facial expression. Okay, let's now take it forward. Having understood the facial nerve, let's understand that when this facial nerve undergoes an injury, the condition is called as facial palsy. Okay, so facial nerve, as you know, is a long nerve. It has a long course. It can be damaged anywhere along this course. How do you know? How do you treat if you don't know where it's damaged? So remember, associated symptoms will help you to go to the exact point where the facial nerve is damaged. Please come to the screen to understand what I'm talking about. You can see a table here. Primary lesion of the patient is facial paralysis, but he also has associated lesions, which will help you to tell where the exact injury is. So what happens? Sometimes only lower half of the face is paralyzed. Surprisingly, it means the patient has an upper motor neuron lesion. Sometimes patient is coming with a 6th nerve lesion as well. So eye is having a medial squint. LR6, lateral rectus is gone. So eye is medially rotated. Okay. In that case, the injury is in the pons where the facial and the abducens nerve nuclei lie very close together. Excessive sensitivity to sound. I can't bear this sound. This is too much. This is damage to your stapedius muscle. Okay, so which means the injury is in the middle ear. Loss of sensation of taste to anterior 2/3 of tongue. Which nerve is gone? Chorda tympani, which is given off in the middle ear. So the injury is proximal to the chorda tympani branching from the facial nerve. So injury is again in middle ear. Finally, when the patient comes with pure paralysis of the face, the injury is likely to be along the extracranial course. Okay, so thus associated lesions will help you to understand where the exact injury is to your facial nerve. An interested student, I request you to please study the point number 1 a little further, and also remember, sometimes in patients of hemiplegia, despite the entire paralysis of facial nerve, emotional movements of face are preserved. If you are interested, you can read upon this. Right. So we said that paralysis of facial nerve is known as facial nerve paralysis or facial palsy. How do you see this patient? What you do is you listen to the patient's presenting symptoms. What is he coming with? Then you observe the patient, see the patient, and then you examine the patient. So these are the 3 things we are going to discuss now. Okay? Presenting symptoms. Look at the image to understand. The patient comes and says, my muscle movements of face are affected. I am not able to move them well. My face is looking distorted. I have drooping of my eyelid. I have sagging of the angle of my mouth. These are the presenting symptoms of the patient. Now you begin your job of observing the patient. What you observe is, how is the forehead of the face? Is it smooth? Yes, it is smooth, because all the action of occipitofrontalis, which causes some horizontal creases on the forehead, is lost. Look at the eye. It may not be completely closed. It may be incompletely closed with a drooping of the lower eyelid. If the lower eyelid is drooping, you will find some tears dripping down his or her face. You may have the patient coming with a handkerchief in his or her hand trying to just wipe those tears, or maybe tissues. Nasolabial fold is gone. Okay, please use the image to understand better. The angle of the mouth begins to droop downwards. There is saliva dripping down from the angle of the mouth, and the speech of the patient is affected. So this is your observation. You're not touch the patient yet. You are just observing and you see all these things and you have thought, okay, this is facial palsy. Now you begin your tests on the patient, okay? How do you test? You ask your patient to look forward and without moving the head, ask the patient to look up. You will find the patient causing horizontal wrinkles to come on his forehead. But if the patient is affected, these wrinkles will not be seen. Ask the patient to tightly close his eyes and you try to open it gently. If the eye is affected, you will be able to do so because of the weakened orbicularis oculi muscle. Ask the patient to show his or her teeth. Ask the patient to smile. The side which is normal, okay, that side will rise up because that side muscles are active, other side muscles are paralyzed. So that side muscle will rise up, okay. Ask the patient to collect air in the mouth. Now gently tap on the mouth. The side where it is paralyzed, the buccinator will not be able to hold the air in and you will clearly see air escaping out. These are tests to test for facial nerve palsy. So what are the causes of facial palsy? All these are the causes of facial palsy. Hypertension, stroke, severe diabetes, viral infections and so on. But most importantly, it is an idiopathic condition. For some reason it happens. It happens to some people and there is a clear chance of recovery. You treat the patient with physiotherapy, you treat the patients with certain medicines and patients do recover. It is very rare for the patients to have a recurrence of Bell's palsy or to have it as a permanent lesion. Okay, you can take a screenshot of this so that you can use it later. Right. But the term Bell's palsy itself, which is associated with facial palsy, usually means a lesion of the facial nerve in the facial canal. The nerve swells up, the narrow facial canal compresses the nerve, causing a temporary loss of function of the nerve. That is specific definition of Bell's palsy. I have a question for you. See if you can solve it. As the facial nerve exits out of stylomastoid foramen, who enters into the same space through the same foramen? Yes, the answer is stylomastoid branch of posterior auricular artery. So let's revise what we've done. Okay, we've revised muscles of facial expression first. We started the story of facial nerve. We talked about its intracranial course, we talked about its extracranial course. Then we drew the facial nerve and we understood its relation to the parotid gland. We talked about lesion of facial nerve, which is called facial palsy. It's associated with associated symptoms, which will help you to come to the exact site of lesion. Patients of facial palsy to be first listened to, presenting symptoms, observed, and then you carry out your examination. Causes of facial palsy we have discussed. Finally, let's now come to the last few minutes of the class, the sensory supply of face. Sensory supply of face consists of 11 branches of trigeminal and 1 great auricular. So 11 looks like a lot of numbers, but actually there are 3 divisions of trigeminal which give rise to these 11 branches. Okay, the 3 divisions of trigeminal are ophthalmic, maxillary and mandibular. These will give rise to 11 branches. It's better that you see it than I talk about it. Right. So here you are seeing a human being with 4 zones on the face, a pink zone, a yellow zone, a blue zone and a green zone. The pink zone is the ophthalmic division of trigeminal. Nerves from here will be branches of ophthalmic division of trigeminal and they will be supplying that pink portion of the face. The nerves are supratrochlear, supraorbital, lacrimal, which also supplies the eyelid and the conjunctiva, the infratrochlear and the external nasal, which goes on to supply the tip of the nose as well. Now the next nerve we see is the maxillary, the yellow zone. Okay, here the maxillary gives rise to 3 branches. One is the zygomaticotemporal going towards your temple. One is the zygomaticofacial supplying the area over your zygomatic arch. And finally, infraorbital that spreads out in the region of the face here. Then we come to the mandibular, the blue zone. Again, there are three branches of mandibular here. One is the auriculotemporal going up to the temple, the buccal which is spreading out in the region of your cheek, and the mental nerve which is supplying the region of your chin. Okay, so these are the 11 branches of trigeminal that supply your entire face, the pink zone, the yellow zone, and the blue zone. What is left is the zone over the angle of mandible supplied by the greater auricular nerve, the great auricular nerve, which is a branch coming from cervical plexus. So we've completed the sensory supply of face, 11 plus 1, 11 branches from trigeminal and its 3 divisions, and 1 branch from cervical plexus, great auricular nerve. The applied anatomy for this is trigeminal neuralgia. So what happens is, patient often experiences very severe pain along the distribution of trigeminal nerve. This is usually seen in distribution of maxillary and mandibular nerve. Ophthalmic is often spared. Okay, and so this is quite a common condition and usually needs injection of alcohol contents into the region of the trigeminal nerve so as to prevent the pain from ascending deeper in. Okay. With this we come to nerve supply of face, motor as well as sensory and its related applied anatomy. Dear students, remember, mastering a skill takes time. So this particular class contains a lot of details about muscles of facial expression, branches of facial nerve. Do take screenshots, study repeatedly, or go back and see the whole video again so that you will learn the details of what has been taught today. Thank you very much. It's been a pleasure as always taking a class for all of you. I hope you've enjoyed it too. If you have any doubts, of course put them in the comment section and I'll do my best to get back to all of you. Thank you so much.